Dr. Baliga here. Today's podcast is on the US FDA's announcement of approving Dapagliflozin oral tablets for adult patients with systolic heart failure to reduce the risk of cardiovascular death and hospitalizations for heart failure. Heart failure impacts nearly 6.5 million Americans and contributes to 1 in 8 deaths in the US. And therefore, this approval provides patients with heart failure with reduced ejection fraction an additional therapeutic option to improve survival and reduce the need for hospitalization, said the FDA press release. Dapagliflozin is the first in this particular drug class, that is SGLT2 inhibitors or sodium glucose cotransporter 2 inhibitors, to be approved by the FDA to treat adults with NYHA class 2 to 4 heart failure with reduced ejection fraction. It was evaluated in the DAPA heart failure trial, where its safety and effectiveness was evaluated in a randomized double-blind placebo-controlled study of 4,744 participants. The average age of the participants was 66 years, and more participants were male, that is 77%, compared to females. To determine the drug effectiveness, the study investigators examined the occurrence of cardiovascular mortality, hospitalizations for heart failure, and urgent heart failure visits. Participants were randomly assigned to receive once daily dose of either 10 milligrams of dapagliflozin or placebo. After 18 months, patients who received the study drug, dapagliflozin, had fewer cardiovascular deaths, hospitalizations for heart failure, and urgent heart failure visits than those receiving placebo. Mortality from cardiovascular causes occurred in 9.6%, that is 227 patients in the dapagliflozin group, and 11.5%, that is 273 patients in the placebo group. The hazard ratio was 0.82, 95% confidence interval was 0.69 to 0.98. What are the side effects of this medication? Dapagliflozin can cause dehydration, serious UTI, and genital yeast infections. Elderly patients with kidney problems, those with low blood pressure, and patients on diuretics should be assessed for their volume status and kidney function. Patients with signs and symptoms of metabolic acidosis or ketoacidosis should also be assessed. It can cause serious cases of necrotizing fasciitis of the perineum or Fournier's gangrene in patients with diabetes. It can also cause low blood sugar in people with diabetes when combined with insulin. What's remarkable of therapy with SGLT2 inhibitors, including empagliflozin, is that the benefit is driven by reductions in hospitalization for heart failure and cardiovascular mortality, but not by a lower frequency of myocardial infarction or stroke. The benefits of SGLT2 inhibitors are independent of glucose lowering. In the DAPA heart failure trial, among patients who received dapagliflozin, the frequency of primary composite outcome was 26% lower than among patients who received placebo, and the confidence interval p-value was 0.001 with a number needed to treat of 21. Multiple secondary cardiovascular outcomes were also beneficial, including a reduction in the total number of first and recurrent hospitalizations for heart failure, a decrease in all-cause mortality, and an improvement in the quality of life. There were many other adjudicated events, and the benefits are remarkably consistent among outcomes and pre-specified subgroups, which supports the fact that dapagliflozin is beneficial. It was associated with few adverse effects and with no excess of dangerous but rare adverse events as was seen in some previous trials of SGLT2 inhibitors. Moreover, hypoglycemia and volume depletion were uncommon. Important highlights of the DAPA heart failure trial. The benefit was additive to background therapies for heart failure. Although the baseline systolic blood pressure and heart rate suggests there was room for dose titration of GDMT. Secondly, the magnitude of benefit was similar regardless of the presence or absence of type 2 diabetes. And thirdly, the magnitude of benefit was similar to and reminiscent of benefits of Entresto, that is sacubitril valsartan combination, and angiotensin receptor neprilysin inhibitor in the paradigm heart failure trial. However, most patients in the DAPA heart failure trial had moderate heart failure, and the side effect profile in patients with more severe heart failure will need further evaluation. An important consideration is only 10% of the patients in this trial were on Entresto, so definitive conclusions about the benefits and side effects associated with SGLT inhibition in combination with sacubitril valsartan remain unclear. In an elegant editorial in the New England Journal of Medicine, Dr. James Fang, MD, Chief of Cardiology at the University of Utah, goes on to say that there are certain matters which need clarification. The data regarding the individual doses of background heart failure therapies were not reported, and therefore the magnitude of the benefit of SGLT inhibition might have been attenuated if the patients were treated with higher doses of goal-directed medical therapy for heart failure. He also went on to say, multiple mechanisms of benefit associated with dapagliflozin have been hypothesized but could not be defined from this trial. He discusses major barriers to incorporating this in the daily practice of heart failure, given that when he wrote this editorial in November 2019, only 15% of eligible patients with heart failure were receiving a combination of sacubitril and valsartan. Moreover, given that these medications are used for treatment of diabetes, and if patients are already diabetic, it may be intimidating for non-endocrine providers to prescribe this medication. Furthermore, he expressed the usual concerns of polypharmacy, including potential side effects of complex medical regimens, unanticipated drug interactions, and challenges with drug adherence. In addition, the cost of new medications may provide challenges. He goes on to say, paradoxically, these various issues may create a risk-treatment mismatch in patients with the at greatest risk are those least likely to receive appropriate therapy. In my opinion, one of the greatest benefits of this group of drugs is it does not cause hypertension. Unlike beta blockers, RAS pathway inhibition, including sacubitril valsartan combination, so is an important addition to the armamentarium of a clinician to manage heart failure and improve survival.